Wooten from the exact Alexandria Neighborhood Health Service.
Hi there, and welcome, and thank you all for being here. There can't be too many of us showing up in this venue and making the statements that we have to make. I am the executive director of what is now Neighborhood Health, actually, and we're a federally qualified health center. We provide primary medical, primary dental, and primary behavioral health services in 2013 to about 14,000 individual patients through 11 service sites in Alexandria, in Arlington, and in southern Fairfax County. The patients that we serve, 69% of them are uninsured. As actually today, 62% of them are uninsured, and the difference there really is the marketplace. Those individuals that we've been able to enroll in the marketplace and have been able to become insured, that number would go down lots more dramatically if we were able to close the coverage gap, because more than 60% of my patient population is at or below 100% of the federal poverty level. Those are the neediest of the needy, and those are the folks who really have no options in terms of coverage. At Neighborhood Health, in 2013 we provided 48,000 encounters, 69% uninsured. 17% of our patient population today is Medicaid, and that's primarily children. We provide services cradle to grave, children to the elderly, and behavioral health services and dental services as well. 1,994 children are on our Medicaid rolls, and 400 adults. The other thing that's really important to recognize, and I try to say over and over and over, because we live with these people every day, we see them, we know who they are, and more than 95% of them are hardworking, employed individuals. They're not slackers, they're not people who don't want to contribute, they're not how they've been portrayed. They're people who work actually to drive our taxi cabs, to serve us in restaurants, to take care of our children, to clean our houses, to maintain our lawns. Those are the people we're talking about. They're people we interact with in our communities every single day. So they're not people who choose to be uninsured. They're not people who choose to be unemployed. They by and large are employed, and many of them employed both parents in a household, and still their income is below 100% of the federal poverty level. So it's really important to understand who we're talking about here, and the magnitude of the need. If Neighborhood Health in 2013 had been functioning in a state that had expanded Medicaid, we would have had an additional $992,000 on our bottom line, which would have allowed us to provide services to more than 2,000 more people than we served in 2013. So it's really important to recognize that economic impact in our communities. And it's not just $992,000 to my bottom line. Those dollars, actually 65% of them are payroll. Those folks live in our communities. They go out and spend those dollars in our communities. The economic development impact of those dollars is more than 4 times the $992,000 that it would have meant to my budget and to the uninsured patients that I serve. So again, we can't ignore that in the service area for Neighborhood Health, which is The city of Alexandria, there are 6,067, or that's the estimate of how many individuals there are who would be covered if we had expanded Medicaid. In the city of in Arlington County, there are 6,768. In Fairfax County, there are 35,408 individuals who would be eligible for Medicaid coverage if we closed the coverage gap, or would be eligible in the marketplace or whatever plan we were able to work out. So it really is imperative. The numbers of people whose lives we're playing around with because of a political game, and very honestly, that's what it is just appalling. None of us should be able to sleep at night knowing that that's going on in a society that we have any kind of ability to impact. So thank you.